Hi all, welcome to Raaonline. As you move from normal physiology to extracorporeal physiology, you are bound to have some common problems. This common problem includes awareness, hemodynamic instability, a little low in saturation, or sometimes even low cardiac output, lung problems, many common issues you can face with cardiopulmonary bypass. Let us look at one of the most common problems, that is awareness during cardiac surgery. When you put on cardiopulmonary bypass, it is more frequent. So, your awareness you should assess during as well as after cardiopulmonary bypass. In cardiopulmonary bypass, you cool the patient to 28 to 30 degrees Celsius. Then again you rewarm to 36 to 37 degrees Celsius. During this rewarming period, the thermoregulatory site and hypothalamus also gets perfused with warm blood and patient may sweat. This sweating may not be taken as awareness, but you have to understand that sweating is also a sign of awareness if your anesthetic concentration are low during the period when brain is normothermic. That is very important. Coming to the risk factor for awareness, there is a long gap between your anesthetic drug administration, your sedatives and narcotics or muscle relaxant. There is a long interval of 35 to 40 minutes and you administer a small dose of anesthetic drugs. In cardiac patients, you think that larger dose of anesthetic agent can cause hemodynamic disturbances and you try to restrict your anesthetic drug. This relatively small dose can have an increased incidence of awareness, and putting the patient on cardiopulmonary bypass where there is going to be lot of hemodilution and your drug metabolism is altered. So, the patients are slightly increased prone for awareness when the patient is put on cardiopulmonary bypass. Young patients are more prone for awareness when compared to elderly population. To prevent this, you give volatile anesthetic agent immediately once your ventilation is established, and also don't forget to administer the sedative hypnotics and opioids. Sometimes you start on propofol and dexmedetomidine infusion after weaning from cardiopulmonary bypass till the patient is shifted to the intensive care unit. One such monitor for awareness is Bispectral Index. By monitoring the Bispectral Index, you can decrease the incidence of intraoperative awareness. But in cardiac surgery and when you use cardiopulmonary bypass, there can be false high Bispectral Index. This can happen with interference from the pump head rotation, use of pacemaker and extreme hypothermia. The processing of this raw EEG data to generate a BIS number takes over 15 to 30 seconds. So, there is going to be a lag period of 50 to 30 seconds with BIS monitoring. Now, coming to neuromuscular agents which is given to prevent the movement of the patient. Here, the dose of neuromuscular agents during and after cardiopulmonary bypass, it is going to be difficult. As I said earlier, there is going to be hemodilution and your drug pharmacology is altered. So, the ideal way is to use a peripheral nerve stimulator to space the neuromuscular blocking agent. The movement of the patient definitely indicate that patient is aware. But in cardiac surgery, such movement can be extremely dangerous because it might result in dislodgement of the aortic and the venous cannula, or sometimes even the monitoring arterial line or central line can come out. So, you have to be very careful to prevent the movement of the patient. Another important thing is shivering can occur. Your temperature goes down to 28 to 32, again it comes to 36, and again once cardiopulmonary bypass off, the patient might cool a little bit. So, this after drop in temperature may cause the patient to shivering. Shivering increases the oxygen demand by almost 300 to 600%. So, you should avoid shivering by administering a neuromuscular blocking agent. You have to be very careful in the post bypass period to avoid shivering.